Assalamu alaikum everyone. Today's video is a continuation of my previous lecture on congestive cardiac failure. In this video, we will discuss the management of congestive cardiac failure. So let's start with the initial management, that is lifestyle modification, which includes sodium restriction to less than 4 gram per day and fluid restriction from 1 to 2 liters per day, weight loss of the patient, cessation of smoking, alcohol cessation, daily exercise, and weight monitoring. This weight monitoring is very important to check the fluid retention in the body of the patient. And also influenza and pneumococcal vaccination should be done in these patients every year, because these patients are more prone to the infections by these two microorganisms, that is influenza and pneumococcus. And these two organisms increases the mortality and morbidity in these patients. So vaccination is very important in these patients. Now come to the drugs that are used for the symptomatic relief in the congestive cardiac failure, especially the systolic dysfunction. The commonly used drugs are diuretics. Remember, the important point here is the diuretics does not improve the mortality in these patients. These are used just for the symptomatic relief. These drugs, diuretics, basically losses the sodium and water from the body and hence decreases the preload in these patients, so decreases the workload on the heart, but does not improve the mortality in these patients. These includes the loop diuretics, that is furosemide and bumetanide. These are more potent, and less potent drugs are thiazide diuretics, which includes hydrochlorothiazides. The side effects of both these two diuretics is hypokalemia. Now talk about the management of the basically the pharmacological management that improves the outcomes in the systolic dysfunction, or in short we can say that the drugs that improves the mortality in these patients. These includes the first line management is ACE inhibitors, that is angiotensin converting enzyme inhibitor. It inhibits the conversion of angiotensin 1 into angiotensin 2. As we know that the angiotensin 2 is a vasoconstrictor, so by the inhibitory effect on angiotensin 2, there is a vasodilation. Venodilation leads to decreased preload and arterial dilation leads to decreased afterload. Hence, the workload on the heart decreases, and these drugs improves the mortality in these patients. These drugs include captopril, enalapril, and lisinopril. These drugs basically has the side effect of dry cough. So if the patient develops the dry cough, then shift the patient to the ARBs. These ARBs also improves the mortality. These are angiotensin receptor blockers, type 2 angiotensin receptor blockers. These has direct inhibitory effect on the angiotensin 2 receptors. These has same mechanism action but direct mechanism of action on the angiotensin 2 receptors. So these drugs also decreases the preload and decreases the afterload by the same mechanism as that of and ACE inhibitors. These ARBs include candicertin, valcertin, and losartan. These drugs have side effects like renal failure and hyperkalemia. Beta blockers are integral part of the management of congestive cardiac failure. These beta blockers improves the mortality and also improves the ejection fraction in the systolic dysfunction of congestive cardiac failure. So these drugs, the most commonly used beta blockers are metoprolol, bisoprolol, and carvedilol. Congestive cardiac failure, or especially the systolic dysfunction, includes aldosterone antagonists. These are spironolactone or eplerenone. These basically inhibits the aldosterone receptor and losses the sodium from the body, due to which there is decreased preload in the body. So these are used only in the patients whose ejection fraction is below 35%, and these drugs also lowers the mortality in these patients, and used especially in the advanced stages of congestive heart failure. Eplerenone is basically alternative to spironolactone, because the spironolactone has the side effect of gynecomastia. The other drugs includes hydralazine and nitrate combination. Hydralazine is arterial dilator and nitrate is venodilator. So by the venodilation, it leads to decreased preload, and by decreasing the resistance in the arteries, it decreases the afterload. So these two drugs are very important, and these drugs are used in those patients who cannot tolerate either the ACE inhibitors or the ARBs, that is angiotensin receptor blockers. And the other drugs, which are these drugs also Hydralazine and nitrate combination also reduces the mortality in these patients. The next drugs which is used is ivabradine. This ivabradine is basically a funny channel blocker in the SA node, and this should be used in those patients whose heart rate is greater than 77 beats per minute. It also improves the mortality in these patients. The next drug is digoxin. This drug is used in severe stages of congestive heart failure, in the last stages of congestive cardiac failure, and these are positive inotropic drug and improves the contractility. So these are used in the systolic dysfunction, but important point here to be remembered is it is used in when the congestive cardiac failure is associated with atrial fibrillation. Then this drug is used, but this drug does not improve the mortality in these patients. Now, few words about the non-pharmacological management of systolic dysfunction. This non-pharmacological management includes CRT. CRT means cardiac resynchronization therapy. It basically resynchronizes the atrial and ventricular activity at the regular interval, and in which the biventricular pacemaker is inserted into the heart and the battery is placed outside the body. This technique is used in those patients whose ejection fraction is below 35%, that is advanced stages of congestive cardiac failure, and this device basically reduces the mortality in these patients. The next technique is ICD, that is implantable cardiac defibrillator. It lowers the mortality by helping to prevent the sudden cardiac death, because it picks up the irregular heartbeat and prevents the sudden cardiac death in these patients. And the indication for this technique is also that ejection fraction is below 35% and class 2 and 3 symptoms despite of the class 2 and 3 symptoms of New York Heart Association classification in spite of the medical management. Now come to the next technique, that is VAD, ventricular assisted devices. These devices are basically placed in the abdomen of the patient, and these devices acts like a artificial pump and helps to deload or unload the left ventricle directly into the aorta. But remember that these drugs has a side effect. These are thrombogenic, so heparin or warfarin is used in those patients who are at the VAD, like heparin or warfarin should be used in these patients because these drugs can cause thrombo. This technique is thrombogenic technique. The next or the last management, non-pharmacological management, is cardiac transplant. This is the last step, and it should be done in intractable heart failure. And the side effects or the complications includes the infections in the patients, recurrent infections, and it accelerates the atherosclerosis or thromboembolism, and there may be a rejection by the body of the patient. If the rejection occurs, then treat it with the high doses of steroid. However, the cardiac biopsy is often used to confirm the diagnosis. So these are the non-pharmacological treatment options in cystic dysfunctions. Few words about the management of diastolic dysfunctions. In the diastolic dysfunction, beta blockers like carvedilol, bisoprolol, and metoprolol can be used, and diuretics like loop diuretics or thiazide diuretics can be used, but the other drugs have uncertain effect in the management. Now let's summarize the management of congestive cardiac failure according to American Heart Association classification. It consists of four stages: stage A, B, C, and D. Stage A consists of high risk factors are involved, but there are no sign and symptoms. At this stage, the risk factors should be reduced and education of the patient is important. Treat the underlying risk factors like hypertension, diabetes, high levels of cholesterol, and ACE inhibitors or angiotensin receptor blockers should be given in some patients only. In the stage B, there are structural changes in the heart like fibrosis or expression of fetal genes and left ventricular hypertrophy, but no sign and symptoms are present. So in these patients, along with the ACE inhibitors or the ARBs, these drugs should be given to all patients, then add the beta blockers in only few patients. As by this chart we can see that ACE inhibitors or the ARBs are the acting like a first line management in the congestive cardiac failure. Now come to the stage C, in which there is a structural changes as well as sign and symptoms of congestive cardiac failure in these patients are positive. Initially, the ACE inhibitors, like stage B, ACE inhibitors plus beta blockers in all the patients, but add the diuretics and digoxin, which is positive inotropic agent in some patients, and then RCT, that is CRT or RCT, resynchronization cardiac therapy in few patients, along with the aldosterone antagonist, that is spironolactone. So this was the management in stage C. In the stage D, there is a refractory sign and symptoms. Special interventions are needed in case of intractable congestive cardiac failure, like along with all the drugs, along with the positive inotropic agents, and add the ventricular assisted devices, and the last option is transplant. So this was the management or summary of the management according to American Heart Association classification. So we have completed the congestive cardiac failure. So thank you so much for watching this video.